Many patients reach out to me with question regarding varicocele and varicocele treatment, like when should they consider surgical treatment or is it possible to treat a second or a third grade varicocele without surgery. So today in this video, I will answer some of these common questions that concern many varicocele patients. The first question I get is, if I have a bilateral varicocele, one measuring 2.3 and the other is 2.6, should I opt for a surgery? If you have a bilateral varicocele, then the decision for surgery should be carefully considered. In case where the severity score is not very high, surgery is not immediately necessary at this stage because the veins are not very enlarged. The second question is, can I use any other alternate way to treat varicocele or can I get cured with alternative medicines or not? So let's talk about alternative treatment besides surgery. There are two main approaches. First is exercise and second is Ayurvedic or a homeopathic treatment. Here's what I recommend. Number one is exercise, and this is especially for younger patients 16 to 18-year old. Exercise can be very effective in varicocele. Doing the exercise like Kegel exercise help correct the improper blood flow, reduce the refluxes and improve blood circulation in the pelvic region. In young patients, the recovery rate is quick compared to old age patients. Thus, even a regular exercise can help young varicocele patients. And you do not have to go for any medicines, just follow this exercise regularly, which I have shared. I will add a link to my exercises video in the description box. Give it a try for a while, monitor your progress, and after that, get an ultrasound done once. If you get relief from that, then there is a nothing better than that, because age really matters when you are recovering from something. If the patient is 16 or 17 or 18, then we have seen patients who got healed only through exercises. If the age of patients is 28 or 29, then you may be required to take medicines. But if you are in a young age or in your teenage, or you are just 18 or a 19-year-old, then you should focus on exercise for some time and do exercise which can help you recover easily. Let's come to the next question. Does Ayurveda or homeopathy treatment completely heal or a cure varicocele? I will tell you a simple thing. Neither Ayurvedic treatment or nor homeopathic treatment work on the basis of healing perspective. These treatments do not heal varicocele, however, they act on to manage symptoms and promote vein health. They work on two things. First is working on the symptoms of varicocele, that is that inflammation, and the second is reducing the refluxes of blood, which is the major cause of inflammation. Reflux is the backflow of blood that causes varicocele. Both Ayurvedic or a homeopathic physicians work on a reversing the blood flow. If you see, there are medicines like hemamelis in their prescription, that means physicians are working to open the blockage to correct the blood flow. First, they work on reducing the inflammation and correct the blood flow, and then veins slowly come back to its healing stage. This same thing happens in both Ayurvedic and homeopathy treatment. However, after treatment, maintaining a healthy lifestyle is crucial to prevent reoccurring of varicocele. Now, the next thing you must do is maintain the results that you got with the alternative medicines. Once your condition improves, it's important to maintain a healthy lifestyle. Don't go back to unhealthy habits like eating spicy food or excessive red meat, including goat with meat, if you have trouble digesting issues. These can worsen your varicocele. Opt for a diet that improve metabolism and support vein health also. Another common question is, can running make varicocele worse? Yes, if you run without proper supporter, running puts extra pressure on your veins. Here's what to do instead. Avoid activities like running, cycling and heavy gym workouts. Instead, opt for activities like walking or swimming with proper support. I hope this video answered most of your questions about varicocele. If you have further questions or a concern, feel free to reach out to me on my team. Until next time, take care.